Okay, here's part 3 of your asepsis lecture. Just going to go over a few practice questions for you. During the blank stage of infection, early signs and symptoms of a disease are present but are often vague and nonspecific. And the answer is prodromal. So remember, this is the most contagious stage of the infection, and they don't really even know that they're sick yet. There are 5 signs of infection that appear at the site of injury or inflammation: redness, heat, swelling, blank, and loss of function. So think about if you have a cut and suddenly it has these things, which one is missing? And the answer is pain or tenderness. An organism's potential to produce disease in a person depends on 4 factors: the number of organisms, the person's immune system, the length and intimacy of contact between the person and the microorganism, and the organism's blank, or ability to cause disease. What's that term called? The answer is virulence. Virulence is the term for the ability to cause disease. Mosquitoes, ticks, and lice, also known as blank, are carriers that transmit organisms from one host to another. Mosquitoes, ticks, and lice are known as vectors in this instance. Okay, so here's your assignment. Okay, so go to the discussion board on Blackboard, pick a disease, use the internet to put together 3 teaching points for patients for the prevention of that disease. So let's think of some examples. It should be an infectious disease or illness: Lyme disease, malaria, flu, the cold, C. diff, anything you can think of, okay? And even if it's not something that can be passed from person to person, if it needs a vector, such as Lyme disease, that counts, or malaria, okay? So write on the discussion board your disease title and at least 3 teaching points. So try not to copy one that someone else did. Try to come up with something, because there's at least one for everybody in the class. And this will help you start to think like a nurse. Okay, so good luck. If you have any questions, let me know.